Welcome, everyone. Thank you for joining us. My name is Melissa Warner, Executive Vice President at HealthCom Media, publisher of American Nurse Today and several other healthcare-related websites and journals. I'll be serving as your moderator for today's educational presentation. Our topic today is clinical communication and collaboration, best practices and use cases. Our main presenter today is Karen Moore, an implementation specialist at Telmediq, a mobile clinical communication platform for healthcare. Karen is a registered nurse and clinical informaticist with over 30 years of experience. She has worked to improve clinical workflow for nurses in hospital settings and has helped to design solutions to improve workflow, throughput operations, and beds and staffing logistics. Joining Karen today for the Q&A portion of our presentation is Telmediq founder and CEO, Ben Moore. Ben's primary focus at Telmediq is driving product innovation. He is best known for connecting with customers directly to understand their challenges in order to optimize product development. We welcome Karen and Ben today and thank both of them for their valuable time and information. Telmediq, offering innovative solutions in clinical communication and collaboration, brings this educational program to you, and we thank them for their support. Now I'd like to welcome our presenter, Karen Moore.
Thank you for the introduction, and it's great to be here today. I'd like to talk about what is a clinical communication and collaboration platform. I want to discuss what I've observed in the healthcare industry and challenges nurses are having as it relates to their communication and their workflow. How communication and collaboration platforms have evolved to mitigate many of these challenges nurses face every day. And I would like to give you a brief introduction to our organization and then leave some time for you to ask questions at the end. To start, the reason we are here is because of the enormous cost of communication breakdowns and nurse dissatisfaction with their current communication workflows. This is not just measured in a dollar amount, but also in the quality of patient care. The OnDemand Institute found that 80% of Sentinel events were related to breakdowns in communication. I'm sure many of you have had your own personal experiences with this, resulting in bad patient outcomes. The issue of alarm fatigue has been discussed by many in healthcare, but very few people have found a solution. The Joint Commission also added it to their national patient safety goals and mandated that hospitals address this issue. When every alert comes through the same way, nurses become desensitized and complacent. For example, I was a nurse manager of a 32-bed medical surgical trauma ICU. I would have this one surgeon come to my office, ask me to walk with him to the unit. We went out to the nurses' station where the central monitor was going off nonstop, and all the nurses were running around. It's not because they were neglectful, but as the Health and Human Services study confirmed, 85 to 90% of alarms are false, such as lead disconnect and pulse oximetry. The continuous barrage of information of alarms is only getting worse now that we are adding more alarms from the electronic medical record and supporting patient care systems. This slide demonstrates the amount of time a nurse spends away from the bedside. 38.6% of the time is spent at the nurse's station. Patients and family members' interpretation of this time is spent away from their direct patient care. I observed in one facility where an emergency department physician placed a video on the hospital webpage explaining why the provider and nurses spend time in front of their computers. Documentation and care coordination is time spent by the nurse away from direct patient care. How can we fix this issue? How can we integrate systems to get nurses back to the bedside? The part of the slide I find also interesting is number 3. As much as 30 minutes per day is spent signing on and off workstations. This issue and solution we will discuss further in our presentation. How many of you have heard of the term page and pray? Or how often have you played phone tag with a physician? How many times have nurses paged a physician and then waited around for a callback, only to go into a patient's room and have the provider call back to the nurse's station? This is a cost to hospitals. When a nurse's time is wasted just trying to reach the right provider, It reduces provider and nurse satisfaction and can actually cause a delay in patient care. So what kind of challenges do nurses face on a daily basis? How many of you still have paper books with on-call schedules? They're sent out at the beginning of the month and never updated. Lab results. The lab tech gets a critical lab results, calls the nurse's unit to notify the nurse, only to wait on hold. Alarm fatigue. Alarm fatigue may occur when the sheer number of monitor alarms overwhelms clinicians, possibly leading to alarms being disabled, silenced, or ignored. When we begin to work with organizations, we see a number of overlapping vendors and platforms that don't talk to each other. This equals a breakdown in communication. Many facilities identify a problem and purchase a solution only to find that it may be a good solution, but it does not talk or integrate to their existing systems. Not only are there technology silos, there are user silos as well. The needs of all of your stakeholders are different. The communication needs of a nurse are much different than those of a rounding hospitalist or specialist. How does clinical communication and collaboration platforms help nurses? Instead of adding secure texting as a siloed solution, we recommend investing in a clinical communication platform. The key difference is that it should be able to integrate with other clinical solutions involved in communications like electronic medical records, nurse call schedules, and directories. The goal is to provide nurses a unified inbox so they're logging in and out of multiple solutions to improve their daily workflow and reduce the number of non-clinical tasks so that they have more time for their patients. I'd like to share more valuable use cases that are possible when you have these integrations, and also best practices when looking towards secure messaging, clinical communication, and smartphones for nurses. Take a close look at the left side of the slide, a laminated call list that is already scratched out with phone number changes. I spent so much time as a nurse manager updating my call list only to have them outdated the next day. To be able to have a system that is updated in real time is so valuable. Our best practice is to unify call schedules so that when a nurse goes to look for a provider, she looks in one place to find the on-call provider. We recommend the digitalization of the call schedules and have it available on the nurse's smartphone. Make sure you're not just including nurses and providers, but that you're including all disciplines involved in patient care to make it easy to connect and communicate regarding the patient. How many of you still have whiteboards for assignment? As a nurse coming on shift at the beginning of the day, I always wanted to see who my patients were. It is important to find a clinical communication and collaboration system that integrates with multiple electronic medical record systems. We have seen with acquisitions of facilities, we've seen hospitals that have multiple electronic medical records, so the ability to integrate to all of them is important. This integration allows the nurse to pull up her patient assignments on her smartphone and be part of the patient care team. The nurse can then look at her smartphone and see who else is in the care team and easily message them during the day. In addition, nurses want to text message providers so they can easily respond without playing phone tag. When a nurse sends a text message to a provider, they can view when it was sent, when the message was delivered, and when the message was read. The nurse does not have to wonder if the message was received, and the provider can call or text the nurse when he is ready, resulting in less interruptions for the providers. Caution when instituting texting with providers. Providers tend to push back in the beginning because they're worried about receiving too many messages because it is too easy for nurses to just text them. Nursing education in the beginning is imperative. Texting is not a toy. Nurse managers need to instruct their nurses to only text if a situation is the same as you would have paged in the past. Message should provide the ability to attach a patient record to the message for easy reference and to reduce errors on who the communication is about. The ability to send and receive images is important. As you can see on the left, you can see a picture of a chest X-ray. Messages with templates for SBAR and consults are also available. We can send any number of alarms and alerts to your end devices, but we do not want to overload your staff with nuisance alarms. Remember that the monitors in the nurse call systems work as they did, alarming and alerting at the console and the monitors as they in the past. Sending alarms and alerts to the end device is a secondary notification, so only send critical alarms. You can send some nurse call alerts to patient care techs, and some can be triaged by your unit clerk who sits at the console. It is important to have different tones for your critical alerts. Patient falls in the hospital are very costly and increase patient stay and satisfaction. As a nurse manager, I had a sentinel event in my ICU. I had a patient fall out of bed, developed a bleed in his head, and subsequently died. I had to go before the Joint Commission. I had to come up with an action plan. So I put POSI alarms in each room, but when the patients got out of bed, the staff still had to follow the sound and look for the dome light, which was wasting critical time. Bed exits can be sent to everyone's device assigned on the floor, which includes the bedroom number, so they know where the bed exit is located, getting there faster to prevent falls. The best practice is to have a clinical solution that is tied to your electronic medical record, so a nurse can receive instant notifications of critical lab results and stat orders. This streamlines the process and can reduce delays in patient care. A physician can be on another floor, see a lab result, and put in a stat order, and all of these notifications can be sent to the nurse's phone. All of these notifications are timestamped and include data for the nurses for reference. So in the example of the critical lab result, the date, time, and who was notified can be easily reported. Per the Joint Commission, all of these aspects must be captured. When I was a nurse manager in the ICU, we did not have this technology, so the Joint Commission would always find that we weren't compliant and we would receive an RFI for critical lab results. Mass alerting ensures that hospitals have a reliable way to communicate to all users or to a specific group of users instantly. For example, your team will want a solution that has the ability to send a message to a stroke team, a trauma team, or a group of nurses on a certain floor. Also, in hospital-wide emergencies, the ability to send a message to all users related to weather, an active shooter, or system-wide notifications. This is a photo from a hospital we visited recently. Best practice is to adopt a solution that allows you to send hundreds of thousands of alerts per second for emergency situations. Many solutions have limits and can only send messages in 100 batches per minute. We recommend you find a solution that you can automate non-clinical tasks for nursing staff. If you aren't familiar with near-field communication, NFC technology, it's similar to the QR code trend. With Telmediq, we take advantage of that technology by associating different NFC tags with different items or tasks. For example, you can put a Telmediq tag on a shelf of syringes, and when they run out, a nurse can simply tap her smartphone to the tag and it sends an automated message for restocking. This message includes the item and location to be restocked. This saves the nurse from calling to have the item restocked and get her back to the more patient-centered issues. When a facility decides on purchasing smartphones for the nursing staff, there are many questions and choices. We recommend that nurses be provided a corporate device instead of bring your own device. We want to ensure that the device meets all the technology needs to support the applications required to accomplish their job requirements. Device sanitation is very important to address. You need to ensure that the device can withstand cleaning from isolation rooms like C. diff and MRSA. Most type of devices have instructions to tell you which wipes to use, such as your purple tops, your gray tops, etc. Ergonomics. Ergonomics may not be an important thing to consider, but it is. A hospital down in North Carolina instituted some smartphones and asked me to come in to do a workflow. I came in to review their current state. I went down to their emergency room department and looked at their workflow. The nurses all had their phones attached to the back of their shirts when they were walking around. The new phones had no way to attach the phones anywhere. They had to be put in their pockets. The emergency room nurses did not adapt to these phones, put them on the corners, and never used them. They saw no value to the phones at all. So I would definitely get your clinicians involved when choosing your device. Earlier in the presentation, we discussed that 30 minutes out of every day is spent logging in and out of systems. We recommend a solution that can integrate with single sign-on badges so all nurses have the ability to tap and log into their phone. Logging in and out with punching in credentials is no longer required. And we also can provide automatic logout when the phone is placed in the charger. Modern secure operating systems, Android 6 or later, iOS 10 or later, no flip phones. We had a nurse the other day at a facility talking about providers that still were carrying flip phones. When smartphones are introduced to a facility, public and patient education is very important to ensure they understand that the nurses are not using their own devices. I've seen where hospitals have put up signage and hospital logos on the smartphones themselves. When introducing a clinical communication and collaboration platform, we can leverage your existing infrastructure and look to the future to help phase out systems such as pagers. We are here to share what we've learned from deploying to thousands of nurses across the US. We are a unified communication platform focused on real-time communication within the healthcare setting. We have over 300 acute and ambulatory partners that we work with across the US and Canada. We work with large hospital systems, acute care, and ambulatory facilities. Many of you are familiar with KLAS. They are an analyst group that surveys vendors' clients on their level of satisfaction. They only work in healthcare. This year, we are proud to say that we won top spot for secure communications. As you know, technology is ever changing and evolving. You want to have a vendor partner that can adapt and transform with the times. Telmediq prides itself on working closely with clients to provide them a clinical communication and collaboration solution that will meet the needs of their clinician. One size does not fit all. To give you a sense of what the next steps are, once we decide to work together, we would begin with a deep discovery and statement of work. Our team would work with selected members of your clinical leadership team to begin mapping out workflows, looking for areas of technology consolidation or integration and functional recommendations. Moving forward, we provide client on-site support, training, and 24-hour support. We've only touched briefly on the clinical communication needs of nurses and some of the key use cases. I'd like to share a full use case document and a few examples that are shown here, such as sepsis alert, alarm management, etc. Please contact me if you are interested in receiving this document or if you'd like a more detailed demonstration tailored to your team's needs and based on the systems that you've already deployed. So thank you for your time today, and let's take time for some questions.
Q&A portion of the webinar, and we already have some questions that have come in that I'll be sending to Karen and Ben. So our first question, I believe this would probably be for Ben. Ben, what if a department doesn't use a scheduling system?
Great, yes, thank you, and I'll take that. That's an excellent question. We run into this very frequently, and that's one of the reasons why Telmediq, we've actually built a very comprehensive scheduling system into our platform that's very easy to use. So if the department doesn't already have a scheduling system, they can in fact use the scheduling system that's been built into Telmediq. Another aspect of this is communication based on roles. So what will happen when any of the clinical staff sign in or badge into Telmediq at the beginning of the shift? They identify the role that they're logging in as, and that will also show them as available. So role availability in tandem with schedules lead to better communication, so people know who's available to communicate with at that moment.
Great, thank you. So another question came in. The question is, are escalations pre-programmed or customized for each client?
That's an excellent question. So in the 6 years that we've been doing this, Telmediq has built a few best practices guides, and also to ensure compliance with the Joint Commission for Communications, such as the critical abnormals. We have built a library of best practices. That being said, when we implement Telmediq at a site, we implement those escalation rules that are site specific. So it depends on the type of communication, the type of clinicians involved. But essentially, at a given site, you'll find that we would have anywhere between 5 to 20 different escalation protocols built in. We get those protocols from the existing hospital's protocols for escalation, and we implement them in software, so they are client specific to your site.
Thank you. So a third question. Which devices are you recommending for nurses?
Yeah, so definitely smartphone platforms are what we are rolling out, and we recommend devices both in Android and iOS, so both Apple and Android devices. As part of our discovery, we work with our healthcare partners. We need to discover, well, what EMR are you on? What other applications are you using or do you want to use with your nurse, with your nursing workforce, your bedside nurses? And then we look at purpose-built devices with built-in barcode scanners. We also consider the ergonomics. The ergonomics are really important in this question because there's a lot of purpose-built, really heavy devices that although they can do things like scanning, the nurses will tend to put them down and not carry them around because they're too bulky or too heavy. So what that's led to for us is we've been able to take consumer-grade devices, which are lightweight, they can fit into the pocket of a scrubs or clip onto a belt. And we've been able to ruggedize those and get them to a point where they can be effectively sanitized as well. The advantage to using those types of devices is that they're quite a bit lower cost and have excellent performance and battery life. So the short answer is it depends on the scenario and the environment, but definitely smartphones and definitely Android or iOS devices.
Okay, thanks. I have a question here that's actually someone would like to get a copy of the presentation and would like a more detailed demonstration. So I think that would speak to contact information, which we would have at the end of the webinar. And then similarly, there's a question related to how a clinician can make a case to management for the systems. So send that over to you.
Great. So so we're answering the question regarding making a case to management for the system. Is that correct?
Yes, I think that'd be a good place to start.
Yeah, that's an excellent point. So, you know, a big part of what we do is, you know, what is the return on investment and how do you make that case? Well, we have some really good data points from engagement with our healthcare partners, and we've done some studies with them, and they've also done independent studies. So we do have a wealth of information which can show a few things. One is an actual hard cost return on investment on reducing the cost of communications in the healthcare environment. So we have a hard cost, what we call our ROI calculator. But I think what's a lot more compelling and important today is that we're actually able to demonstrate key metrics. So we have seen correlations, and we have some studies that relate the use of Telmediq to a decrease in length of stay of your patients, as well as a contributor towards improved HCAP scores. And ultimately, there's demonstrated improvement to patient safety, and an argument can be made there. So in our experience, once this is on the roadmap for your healthcare system, making the case to management is very easy. And we do have some great supporting material that if you would like to speak further, we can provide you with that material.
Okay, I would just like to address the ability to get a copy of the presentation, and more detailed information would be available on demand after this live presentation in probably 24 hours or so. This would be on demand on AmericanNurseToday.com. So just stand by for 2 minutes. I think this is going to conclude the questions that I have in the queue. If anyone has any other questions, now's the time through the chat box. And I think that's going to wrap it up. So I want to thank you both for an excellent presentation. And again, the information on your screen, you can email Sophia Galler for more information related to any questions you may have, and of course go on the website AmericanNurseToday.com, and you'll be able to view this presentation on demand. Thanks again to everyone, and have a great day.